Welcome everybody to Chronic Fatigue and Fibromyalgia Update. This is segment 2 of our Fibromyalgia and Chronic Fatigue Update topic on medical marijuana. Our guest star is Dr. Ginevra Liptan. I'm Dr. Richard Podell. In segment 1 we talked about the pros and cons of anybody using medical marijuana, and what I think our conclusion was that for most people, medical marijuana properly supervised is safe and effective. There are some people for whom it does not work. There are some people where it's contraindicated for various medical reasons. People can go to segment 1 for that. Dr. Liptan has a lot of experience because in Oregon there are 60,000 some odd patients who are on medical marijuana, not just for fibromyalgia, of course, and it's very commonly used. In New Jersey, it's much smaller group. I have less experience, but I've talked with Dr. Liptan, and it's clear that she really knows what she is talking about. So let's go on to talk about, you've gone to the medical marijuana clinic, and they've given you some powder that they say is a good strain of medical marijuana. We'll talk about the different strains. What do you do with it? What's next?
Okay, good question. So the old-fashioned way of using marijuana was smoking it. So whether it's in a joint, which is like a cigarette, in a bong, or a pipe, and that certainly is still a method people do use. But as a physician, I have to recommend not using that because smoking anything is bad for your lungs. There have been some studies of chronic marijuana smokers that show that they have the same kind of propensity towards developing COPD or emphysema as tobacco smokers. So I definitely recommend not doing that. But there are other ways. So let's say you have your marijuana plant and you do want to smoke it, but you don't want the negative effects from it. You can do something which is called vaporize it. So they sell small, they cost about $100, and it's a small device that heats the marijuana to a very high heat and basically vaporizes it. So what you're smoking is actually marijuana-laced air, not smoke. And you get pretty instantaneous effects. It takes about a minute or two to get into your system, but it only lasts for about 2 or 3 hours. So that's one of the negatives of vaporizing. So if you want something that lasts longer...
What do you call this equipment?
It's called a vaporizer.
It's called a vaporizer.
Yes, yes.
Just like you would use for a kid who had a whooping cough or something?
Yeah, exactly.
Okay. It's not special.
Yep.
Okay.
So it's, but you can get them online or at dispensaries. A lot of them sell it, and the device itself is not illegal. But
okay, so vaporizer is better than taking it as a straight smoke. Okay.
Definitely. But it is expensive, and some people don't like the fact that it comes on very quickly and only lasts for an hour or 2 or 3. So many of my patients prefer to ingest their marijuana. So there's a couple of different ways you can do that. You don't just gnaw on the plant. You have to actually extract the marijuana oil and put it in either a butter or a cooking oil. And then a lot of people use that to make baked goods. A lot of dispensaries themselves actually sell marijuana-infused butter or oil. So if you're not a Martha Stewart type person, you can get it directly from them. A lot of dispensaries also sell candy or other things, coffee that has been infused with marijuana oil, so that you can buy it directly from them. When you ingest marijuana, the effects take about an hour to 2 to get into your system, but it lasts for about 4 to 6 hours, so you get a longer duration of benefit.
Well, in both cases, whether you're smoking it or ingesting it, if a person's in pain 24 hours, can one continue to take this throughout the day?
Yes, with the only concern that if it is affecting them mentally, I wouldn't want them to do it before they were, driving or working. A lot of people that use it for pain find that if they find the right dose for them, it does not affect them very much, and they can do fairly well with just low doses with ingesting it. There is one really nice way that completely eliminates any mental effects of the marijuana, and that's using it topically. Have you heard of using it topically,
Well,
Dr.
I've learned about it from you, and we should caution people that, of course, it's not going to have systemic effect, but lots and lots of our patients, of course, have terrible pains in localized areas in their neck or their shoulder, and my understanding from Dr. Liptan is that this is fairly effective. So tell me a little about it. Tell me an anecdote. Tell me a real patient.
So I've got a lot of patients. I actually learned about this from a patient that she made her own marijuana balm. She basically takes marijuana plant, puts it in her crock pot along with some oil, lets it simmer for 4 to 6 hours. And what she ends up with is a marijuana oil, and she puts beeswax in it to kind of thicken it up, and then some lavender or other things to kind of mask the scent. And she uses it topically, and finds it really effective to reduce fibromyalgia pain in her neck, upper shoulders, but it doesn't affect her mentally at all because it's not really absorbed systemically. So a lot of my patients, particularly people that are very nervous about feeling high, don't want that feeling, will use topical marijuana.
Well, now that's quite fascinating. Well, I'm listening to all the choices people have. Folks who do not generally, shall we say, are not teenagers and conversant with the marijuana community and so on. How are they going to find out how to do all this? Is there a website that's reliable? We talked about the leafly.com.
Mm-hmm.
Is there a website that explains how do you turn a plant into butter?
So Leafly has a lot of good kind of introductory information. There's actually not one centralized website. I wish there was. There is a lot of good information on YouTube, actually. If you search, make marijuana butter, there's some nice instructional videos. And again, dispensaries, the folks that run those tend to be very educational and can, I think, help people learn how to do that. Or you could just go ahead and there actually are marijuana balms that are sold at dispensaries. There's marijuana oils. So a lot of it is already kind of pre-made. And I think it's a great way to try it.
All right. So this seems to be likely an effective treatment, but as we all know, some people are going to get real sedated. Apparently, some forms of marijuana, you actually have an uplift. There are different strains that do different things. Could you tell us a little bit about the different strains? And since there are 500 or so, maybe just 200 or and there are a number of strains that are most commonly used. Can you give people a little guidance for what they might even ask for at the clinic?
Sure. So over the years, as marijuana was used recreationally, the marijuana that has been bred in the U.S. Was bred for very high THC content because that's what people recreationally were looking for. That's what gives people that kind of high, stoned feeling. So for medicinal purposes, the high THC marijuana is actually not what you want. What you want is something that has a balanced amount of THC and CBD, which stands for cannabidiol. So cannabidiol kind of balances out the negative side effects of THC. Cannabidiol is very relaxing. It does not have any mind-altering effects, but it's a good anti-inflammatory and good pain. It's a good analgesic. So I recommend people ask for a strain that has a balanced amount of THC and cannabidiol. And there's one that's in the Portland area a lot. It's called Harlequin, and that's something that has a balanced amount. But again, on leafly.com, they talk a lot about the different amounts. They actually break it down chemically, how much THC and how much CBD is in each strain.
Right. So if one were to go out on the street and buy marijuana, one doesn't have any idea what strain it is.
No idea. And in fact, what you're buying probably is mostly THC and probably very little CBD or cannabidiol.
Right, because people are trying to get high.
Exactly.
Right. And for fibromyalgia patients, getting high is the last thing in the world that they feel they need to do. What they want to do is get relief from pain.
Exactly.
And better sleep, of course. Now,
yes.
And
the cannabidiol is, I think,
this balance one will help the sleep as well.
Yes. Okay. And a lot of my patients use marijuana just before bed to help them sleep. And I think it's actually a really effective sleep treatment. There was a study in the 70s looking at marijuana use and sleep, and it actually increased the amount of deep sleep that people got in that study. And in fibromyalgia, we know that people aren't getting enough of that good quality deep sleep.
Okay, so if we summarize, what you've told us is that there are different ways to take the medical marijuana, and that smoking is probably not the best way. Vaporizing is pretty good, but it doesn't last all that long. Ingesting, I was thinking about, we saw the Woody Allen movie, Midnight in Paris. Alice B. Toklas, who was the friend of the poet Gertrude Stein. I don't know if she invented the idea of Alice B. Toklas brownies, but that's with marijuana in them. And that apparently is fairly effective and longer lasting. And then finally, what I had never heard of is the fact that you can use the marijuana topically if you put it in effect into an oil, and that if you have some localized areas of pain, it would be helpful. Now, there are also other conditions where marijuana can be helpful. Would the same apply, let's say, to somebody who had a bad arthritis? Would it apply to people with diabetic nerve damage? Where else might one think about applying for use of medical marijuana?
I think both those conditions you mentioned could get benefit. I think any painful condition, particularly things that involve nerve damage or inflammation, marijuana has been found to be helpful for those neuropathic, we call it, or inflammatory pain conditions. And interestingly, those are the ones that opiate-based pain medicines like morphine or Vicodin don't actually help very much.
How about migraine headache? Is there any data on that?
There is some data that it can help, and actually the topical medical marijuana rubbing on the temples can help migraine headaches.
Okay, so marijuana would likely be, over the years ahead, be considered a legitimate drug, and it has its downsides, obviously, and you don't want people crashing their cars, and we don't want people getting fat, and so on. But it would seem that it is on the safer side among many of the drugs that we use. On the other hand, we wanted to warn against just going out and buying marijuana off the street, because you don't know what strains you're getting, and you're not really getting the one that's going to maximize pain and minimize mental side effects. And in addition, it can be laced with other things which are not good for you, and in addition, it's still illegal. So, do you have any last word thoughts before we wind up this segment?
My only other thoughts that I wanted to mention is that I've had some patients use marijuana tea. You can brew it as a tea, and that can be really helpful, or use it in a tincture, a liquid tincture. So there's also some liquid forms of marijuana.
So we've learned a lot. Dr. Ginevra Liptan, author of a book on fibromyalgia, medical expert, probably the leading physician expert in the Oregon area, would be fair to say?
Sure.
Sure, okay. Very well known, very effective treating physician. So I thank you very much, Ginevra, for your time. We hope to talk.